My name is Anna Hill and I am a medical herbalist. I also practice manual lymph drainage and I massage pregnant women. When I trained in manual lymph drainage, a number of the therapists I was training with were also using a product called Kinesiotape. They found this Kinesiotape very useful for a wide range of conditions. Sports injuries, just basic injuries, falling over, hurting yourself, rehabilitation, and also for long-term inflammatory conditions, and it is also very useful in treating lymphoedema. During my manual lymph drainage course, I actually fell over and sprained my ankle, and one of these therapists taped my ankle up with Kinesiotape, and it was fantastic. I got no bruising until 2 weeks later when I decided to take all the Kinesiotape off, at which point the bruising started to develop. This made me really keen to learn more about kinesiotaping. Therefore, I trained with Kinesiotape UK. There are 3 levels of courses, KT1, KT2 and KT3, and I trained when an American trainer came over to the UK up to KT3 level. Kinesiotape was developed in the 1970s in Japan by a chiropractor. It has been used widely through Japan for many years since then and is very popular now in Japan. Over the last couple of Olympic Games, many more people have been seen performing sports with blue stripes, red stripes or black stripes on their skin. This is Kinesiotape. It has become a lot more popular worldwide. It is often seen around the knees, up and down the thighs or the calf, or around the shoulders. However, it can be used and applied over many different parts of the body. The name Kinesiotape means it's a tape, but also it allows movement. That's what kinesio means, movement. Many different types of sport tapes or bandages are designed to prevent movement or limit movement. However, Kinesiotape supports joints and supports movement, and rehabilitation is much better if you can support movement rather than restrict it. Therefore, Kinesiotape can be used to help support movement and help support rehabilitation of a number of different conditions. It's a combination of both tape and technique. Kinesiotape, unlike many other sports tapes, is stretchy. This is the tape on its backing material. However, it has quite a lot of stretch in it. And this stretch allows us to use it in a number of different ways. We can apply it with hardly any stretch for some conditions. Other conditions require more stretch when it's applied. It's also important where we apply it, so we apply it over different muscles, over different joints, depending on the needs. We also can apply it at one end of the muscle first, and then apply it up to another end, and that will have a different result than if we apply it at this end and apply it down. So the technique is very important, but if I don't use Kinesiotape and still have a perfect technique, we're not going to get the results. So we need both.
Cool.
The application of Kinesiotape really depends on the condition you're treating. Kinesiotape can be applied over muscles that are overstretched, but also over muscles that are too lax. They can also be applied over a joint that needs support. For instance, if I want to support my wrist joint, I can apply the Kinesiotape over my wrist like this. First of all, apply it to the back of my hand and then stretch it and apply it to the top of my arm. Applying the tape like that gives my arm and wrist a little bit of support. I still have a full range of movement in there, but it is supported a little bit, and so it's easier to hold it up. And that can be useful if these muscles are painful. However, instead of supporting the wrist like this, I may instead apply kinesiotape with a lot less stretch to the muscles that are attached to my elbow and pass down to close to my wrist. It's just a different way of applying kinesiotape, and it treats the muscle rather than just looking at the joint. Kinesiotape can also be applied to reduce inflammation, and in that way no stretch is applied at all, and often the kinesiotape is cut into very small strips and it is applied over the area of inflammation. So kinesiotape can be applied in many different ways, but the whole point of kinesiotape is no matter how you apply it, you still have a full range of movement in the area that you've applied it to, and you should have reduced pain as well. Kinesiotape is hypoallergenic and waterproof. It can stay on the skin for up to 5 or 6 days, but it depends on a number of factors. One of these factors are the type of skin you apply it to. If you apply it to the base of your foot and the foot is very sweaty, it won't stay on for so long. If you apply it to your hands and you wash your hands all the time, it also won't stay on as long. I find when I apply kinesiotape to my hand, it lasts about 24 hours. When I apply it to my back, that's when I get closer to about a week. Kinesiotape can be used at any age. You just don't want to put it on very sensitive skin and then rip it off quickly. Kinesiotape sticks to the skin very well. So if someone has very delicate skin, then I may not use it. I used to think the only therapy you couldn't use kinesiotape alongside was massage, because massage uses oils and kinesiotape will not stick on an oily skin. However, recently I have been massaging someone and also using kinesiotape on her. What we do is apply the kinesiotape beforehand and then massage around and over the area. Therefore, I can't think of any reason why you can't use kinesiotape and any other therapy. No, kinesiotape has been used for over 40 years and its popularity is growing. Kinesiotape is used by many top athletes, top footballers, top divers, top tennis players, and they wouldn't be using it if they didn't find the benefits. Kinesiotape is also used in many NHS clinics and hospitals throughout the UK. The NHS certainly wouldn't be wasting their money. Kinesiotape isn't a fad, it does work.